So if I still have to call Vermont Health Connect to record a change in circumstance as of now, right?
Sure, you can call Vermont Health Connect or go on the website, and there's a form fillable PDF that can be filled out and sent in. The back office change of circumstance is what we've deployed now. With the backlog, if somebody were to enter a change thinking that a pending change had already been processed, it could run into an error. So we're wanting to make sure that that backlog is worked through before turning on automated self-service.
So if I get married tomorrow, how many days before my spouse could be on my Vermont Health Connect plan?
Cass?
So,
Come over here, though.
sure.
Pick it up on the mics. The question was, you get married and report tomorrow and report the change. How long will it be?
So it's important to remember that coverage effective dates are linked to federal rules. So depending on when you report it in the month, that will help dictate when your coverage is actually updated. We're going to employ basically a two-pronged approach. We're going to have staff working on the backlog of change of circumstance requests. So if you had called and you were in that backlog, I would expect at this point for it to take 2 to 3 billing cycles to update. Over the coming weeks, as we get everyone fully trained, that will speed up. And as a part of our phased approach, we will also make sure that folks on the phone can process change of circumstance requests as they come in. So I think in the coming weeks, you'll see a simultaneous backlog reduction as well as an ability to process new things that come into the phone, on the phone.
What's 2 to 3 billing cycles? Is that 2 to 3 months, or is that 2 to 3 15-day periods?
Billing cycle is 30 days.
Okay.
What is the backlog now, Cash?
There's approximately 10,200, and that's evenly split between, or roughly split between Medicaid and qualified health plans. So to be even more specific, if you have a pending change or a series of pending change in the system right now, that would need to be worked through in combination in the queue. If all you've got to do is add a dependent, you don't have any pending circumstances, that's the sort of simple change that the system can manage now.
So you guys are going to work through the entire 10,000 change request backlog, which could take 2 to 3 months before releasing the tool to consumers.
Yes, otherwise people could propagate additional errors by not having the correct changes recorded throughout the system.
But I just want to make clear, Morgan, that's always been the plan. In other words, we expect by, when we go up for, let's remember there's 2 pieces to this. One is, I said we got to change the circumstance tools up and running by June 1, May 31. The other was by October 1st, we need to have a functioning renewal process that's smooth and ready to rock. And that's obviously Optum and the team's next big challenge and big opportunity for us. We always knew that it would, once we got this tool working, that it would take until renewal to get through all of the challenges that we were facing.
Did you say that on in March when you announced these contingencies? You said it would take 2 to 3 months or until open enrollment 2016 for the consumer tool to be available?
I can't remember exactly what I said. We'd have to play back the press conference. I don't think I was asked, to be honest.
Why would it, if you have this new function now that's going to...
But I mean, let me be clear, Morgan. Our team has been consistent about the answer I just gave you right from the beginning.
Yes, I think in the original milestones table, we did indicate that we expected to reach that standard customer service level in that time frame. So Pete, to your question, if you've got this great nifty new tool, why can't you work it through faster? We do need to still be methodical. When you look at some of these service requests backlog on some of the complex cases, if you look at the service request backlog on some of these complex cases, there is a lot to untie. So even though you've got the tool that does it, you may still need to take multiple steps and then also outreach to the customer and make sure that you're getting them the change that they need now. And that simply takes time. So until we see, what sort of response rate we actually have to be able to close out those service requests, we're not able to say any better than that previously established milestone.
So what's a complex case look like?
Cass?
Sure. Stand up here. So a complex case might be someone who has 3 or 4 changes that have happened in their life simultaneously over a period of a few months. So someone might have gotten married, had a baby, changed jobs, and lost their minimum essential coverage to their employer. We have many people who encounter, as we know, a lot of changes that need to be taken care of, and we have to walk through each of those carefully because they sort of all have different federal rules around them in terms of coverage effective dates and outcomes for APTC. So I would consider that a complex case.
Why would my ability to make changes to my own case, if I don't have an existing change of circumstance waiting to be processed, why, if you consider Stephanie's example, would it take up to 3 months for me to add somebody then?
So let me go back to what I said before, that we're operationally, so we've been delivered a new piece of functionality, and now we have to deploy our staff to be able to get through all of that work. So there's a two-part approach to that. If you have a request that's in the backlog, we have staff deployed to specifically work that backlog. And yes, that may take 2 to 3 months for us to get through. That is infinitely faster than we are able to do today. Today, we are underwater on a daily basis with those change requests. If you are calling in on the phone with something brand new, within the next few weeks, we will be able to process that change on the phone for you if you don't have anything pending in the backlog. So for that person, it should not take 2 to 3 months.
So going to Steph's example, if she didn't have previous change of circumstance issues, she just decides she's getting married tomorrow, that is not going to take 3 months. And I think I'm worried about that answer because I don't think it was clear to the press. So
Yeah, so
can
that will happen. So
state
if
in plain
somebody,
English, if Steph decides to get married tomorrow, she's not in line now for change of circumstance, how long will it take her?
we would be able to process that change on the phone and the file would go to the carrier that evening. Your coverage would be updated according to federal rule.
So the
Have you-
next month?
Yes.
Have you guys made,
Has the speaker or the healthcare committee chairs or relevant lawmakers been briefed? And are they viewing this as the success that you were all claiming?
So I did speak to the speaker this morning, and late in the week last week. He was congratulatory. I think we're very clear that the customer service implications are what's most important. So that's what we're focused on delivering.
So you believe he's on the same page and he'd use this as meeting the first goal?
Listen, you got to ask the speaker. All I can tell you is, I've been focused on, which I know you will, I've been focused on getting this job done. And that's what the team has been doing. And, this could have been a very different outcome. This is a huge technology change. As I've said many times, with big technology changes like this, there often are bumps in the road. I don't want to pretend that getting to this date has been easy. I don't want to pretend that it hasn't been without some moments of pulling our hair out. All of us collectively. I had dinner with the speaker on Saturday night, may truth be known, and I did not mention this because I didn't want to jinx it. But putting it, so be clear, I haven't been saying to anybody, we're going to make it. What I've been saying is what I've told you every time you've asked me. We're on track, we're optimistic, we're cautiously optimistic with big technology changes, and this is a really big one. Many things can go wrong. I'm glad to be here today to say we are where I wanted to be.
So at this point, do you feel confident that you're going to stick with Mount Health Tech for the long haul instead of one of the alternatives?
That's the most important question here, and let me be clear. There is no better solution for Vermont than to have our website work. Full stop. If there were the ability to partner with other states or state to solve our problems, we would have done that already. We have been, as you know, incredibly frustrated by getting to this point and the point that we need to be at re-enrollment on October 1st. But the best outcome for Vermont is to have their own website work, and that's what I will continue to try and achieve. And I'm cautiously optimistic that we will make it, that we will deliver finally on what we've always hoped to do.
Does that mean outsourcing SHOP is off the table?
Nothing is off the table for SHOP. SHOP is a small part of our problem because Blue Cross Blue Shield and MVP, they've been ably managing the SHOP market. If I had my preference, they would continue to always manage the SHOP market. The federal government requires us to run SHOP and the other states to run SHOP. So we're working collectively with the feds, looking at other states, looking at collaborations to solve the SHOP challenges, because that is an area where collaboration may well work. But frankly, SHOP is working for us. We wish we could keep it just the way it is.
So if you use this new change of circumstance technology to facilitate any real transactions yet in the live environment?
I'm going to let the Optum take that one.
Justin?
Justin.
So I think, just to carry on what Cass had been talking about earlier, part of the post-deployment validation activities was doing exactly that. So we were able to process a handful of transactions this weekend, sort of surgically moving through the new business processes, working with the system, and that information has been sent over the new integration solution to the carriers. And just this morning, I was on email with Blue Cross, and they're looking at some of those files this morning.
So have you been able to confirm yet, Dawn, whether or not this exercise was a success?
No, even last evening I understood from the updates that the work that Vermont Health Connect was doing over the weekend was being sent overnight to Blue Cross and MVP. So our folks have received it. They'll be looking at it end to end. Be sometime today or tomorrow that testing one scenario at a time will begin to go back either validated or with questions.
And so how long do you anticipate that validation to take?
Well, I'm not understanding totally the total scope of everything that came over, but this has been relative quick turnaround between the state and Blue Cross Blue Shield of Vermont. As test cases come over, they sometimes in a matter of hours will go back. Usually no more than a few days before they're going back to the state.
Worst case scenario, Lawrence, how long before you are able to get this thing humming to the point where it can take stuff, you can process it, and it's all real?
Well, it's important to note that these were all subject to testing prior to deployment. So this is a question of validating that it's working as expected in the live environment. We know we found defects on our side. We would expect that the carriers will also find things that they need to adjust. But we do expect this to go on over the next few weeks. We're going to be taking extra care with each of these transactions to make sure that things are behaving as expected.
To the scenario that Steph put out there, really then, we're not sure whether you could make it for the next billing cycle yet, and you won't be sure about that until you finish this process that could take several weeks.
So, to be clear, all of the files that we've generated at this point look exactly like the files that have previously been moving, and they've moved through Renaissance successfully, so I'm highly confident. As we work through each of these cycles, we'll keep people updated, and if there's any hiccups, we'll certainly let people know.
And so should the
How did you get to a backlog of 10,000 when I thought you were down to 4,000 in March?
So, Sean, do you have the dates?
Come on over here, Sean. That's the mic.
So for the number with the backlog, I think is important to make the distinction we're reporting. There was the number of renewals that needed to be processed, and then the numbers of change of circumstance, which were distinct. And they came in later. As Cass referred to, we worked through the 21,000 renewals were finished as a prerequisite to have the launch and the new system updates come up. The change of circumstance have been slowly rising, I think, as Cass and others referred to. It's been fighting to keep ahead without the new system. So I think as far as if you want specifics, kind of by months, we can have that. But those have been rising, particularly early on in the winter, and then have gone to about the 10,000 now. But again, those being the ones that aren't related to the renewals, which was the priority prior to this.
So we're talking about two different numbers, I think. Is that fair to say, Sean?
Yeah, so there's two different numbers. They were reported as, and they involved very similar processes as far as they had to go through the same steps that Cass described to process these changes, whether it was a change related to a renewal or whether it was a change that came in later. So we had reported on those numbers before. The renewals were the priority, so all of the work the steps that Cass talked about was primarily focusing on bringing down the renewals to meet this, to be able to have the system update happen.
And when
As
you
far
get,
as the
when do you
changes.
get that number too? Because that's the one that Nancy's referring to. What was that number?
Well,
Yeah.
no, I mean,
Right.
I'm trying, I understood that that in October, the QHP backlog was 17,000, and that it was down to 4,000 sometime this winter.
Right.
And now you're saying that
Yeah.
that number is.
It was down to 4,000 early
Or-
in the winter. I think they cleared it out prior to the start of the year, and then at the start of the year, really started rising again. I think we had those
So it
numbers. I
wasn't
think
down to-
in March it was maybe
So the 10,200 open change requests are divided among Medicaid and QHP. So there's about 5,000, 4,800, 5,000 qualified health plan change of circumstances that are pending right now. So that's written slowly. They come in every day and they're retired every day. They've been retired at a slower rate than they've been coming in. So they've been trending up. This change will put us in a position where those are trending down.
I think in March we reported there were about 7,500 in that range, I believe. So I mean, I think they come total, and I think those changes come in, that's about 125 per day. So as Lauren said, they get retired, but not at the same pace that they've been coming in, particularly as the focus was on renewals. So if it was 4,000 early in the winter, and I think up through 7,75, 8,000 in March, now at 10,200, and we're confident that now we're able to have the tools in place, as Cass talked about, to process these that much more quickly and really bring down that backlog.
Has Vermont Health Connect changed its practice of not remitting partial payments, or is Benetton still holding millions of dollars in people's premiums?
Let's take that.
We have not updated the payment practices at this point, so far as I know. Bob, do you know a reconciliation number, or Lori, on where Benetton stands right now?
Last I heard it was $1 million plus, $1.2 million, $1.3 million, somewhere in that neighborhood.
Don, are you satisfied with this reconciliation process and whether or not you're being paid what you should be getting paid?
Well, I can't.
Don, you better come to the
Okay.
mic, or you're going to get yelled at.
It's preliminary for me to comment on my satisfaction with the reconciliation process because it's still ongoing. I have said previously that Blue Cross Blue Shield, the reason we're asking for and working with the state on the reconciliation is we're not receiving the revenues that we should. So we simply need to let the reconciliation process be complete. And once it's complete, we'll have an accurate picture of exactly what that revenue flow looks like.
But does your internal count right now reflect what Bob just said?
I previously said that, until the reconciliation is done, I don't have a number. I would say that it's in the millions of dollars. It's not in the tens of millions of dollars, but neither is it in the hundreds of thousands of dollars. And we have both revenue issues and also claim issues that have been paid for people who have been terminated from Vermont Health Connect but experienced claims after that period of time. So the reconciliation is a substantial piece of work for both Blue Cross and for the people at Vermont Health Connect.
What do you expect to happen to those people who you paid claims for that had terminated their accounts? What should happen?
What should happen? I can only speak for what has happened, and that is that at Blue Cross Blue Shield of Vermont, we've not relieved anyone of their coverage. We've not cut anyone off of their coverage. We're not dunning people for their late notices, and it's simply because of everything we're talking about here today is about having reliable information, change of circumstance being something that's necessary in order for that to be the case. So it would neither be fair or appropriate to cut anybody off of their coverage. So at Blue Cross, we're carrying everyone on their coverage until we can have reliable information upon which we would base changes.
So you're not willing to speculate on what you would do with people whose claims you've been paying, even though they've canceled their coverage, even though you know that that's happening?
But it's all still part of the reconciliation as we speak here today. We don't know how prevalent that's been. We do know it occurs in some cases.
When do you expect this to be resolved?
We would say our timeline is that we feel like this can be resolved by the end of June.
Has this impacted your cash flow or reserves in any way?
It's not impacting Blue Cross Blue Shield of Vermont's reserve. We're reserved appropriately under our regulators, Department of Financial Regulation, the Green Mountain Care Board. So there's, for the finance people, there's some momentary cash flow issues they have to make adjustments to. This is not impacting Blue Cross Blue Shield as a financially strong and appropriately reserved organization.
Lawrence or Governor or whoever, what should the expectation be among consumers right now? Should they feel like, wow, if suddenly this week I have a change of circumstance in my insurance scenario, I'll be able to now call up Vermont Health Connect and have them solve that problem forthwith?
So Vermonters know that this has been our big challenge. We now have the tools to be able to deal with it. It's going to take some time, obviously, as folks have just said, to get folks trained, to do all the integration that's got to happen. But the good news is that we now have the technology able to change circumstance, which should put an end to the huge frustrations that Vermonters have been feeling generally about trying to sign up for insurance products that they need. So does it happen tomorrow? No. Like any big technology project, we've got to learn how to use the system. Will it happen by October 1st? Yes.
So that's the safe date that you can say by which people will be able to have processes that took months take 10 minutes.
Or however long is reasonably
Right.
expected. That's correct.
It's not till October then.
That was one of the milestones that was laid out in March.
With the change of circumstance functionality is May 31st.
Yeah. So,
Right.
so this goes back
This
to
is not new news. Customer service is going to be, as you know.
But that was for the customers to be able to go onto the website. That was always going to be October 1st. But you said the back end would be working. People processing stuff on the back end.
But the question is, what can be assured for all customers?
That's what you
And
asked.
we've said that the customer service standard of a change submitted in the first half of the month being reflected on the following bill, and a change request in the second half of the month following one of the two subsequent bills is expected by October 1st. That's in the milestone. Now, that's when we can say, this is what we expect for all customers. And there will be exceptions before then, because people have a pending change. Remember, it's not just a question of whether or not we've got the change right in our system, it's a question of whether or not the change is correct in all 6 systems. So that's when we say we have to, when somebody's got a pending change, somebody's got to go back and reconcile what those series of changes needs to be, and then take care to move through those correctly. Somebody, long before that, over the next couple of weeks, people who submit an address change or something, that's going to go squirting right through. I'm saying, what can you say to all Vermonters? And that's just simply got to be the prudent later date.
So if can we say that the real milestone today is that you've got new technology which will enable, when a change is filed, it automatically goes to all 6 systems?
Yes.
And
got it.
what Liz Forrest, pardon my ignorance, because I only dip into the healthcare beat as infrequently as possible. But what are these 6 systems?
Vermont Health Connect, Renaissance, the premium processor, Blue Cross Blue Shield, MVP, Medicaid, and Delta Dental. There are other systems that we interact with, but those are the systems that have records in them. We also interact with IRS, CMS, and a whole bunch of other S's.
And I just want to make the point, and I know you've heard it before, but with all the frustration we've all felt, no one has ever tried to do this before with technology. In other words, in all the years that John George has been doing a great job at Blue Cross Blue Shield, he never had to have a system that you would go onto at your home with technology, choose an array of products, push some buttons, and the system is supposed to check your federal income to see what you're eligible for there with the IRS, check your state income, in Vermont's case, to see what you're eligible there for additional subsidies, and put it all together into a neat little package that gets billed back to you on time. In other words, you have to understand that what we're trying to do has not been done by technology designers, insurance companies, or healthcare providers in the past.
Technology's in hand and it'll be October 1st before you'll be able to fully realize the benefits of that technology.
Then between now and then will be a ramp of improvement to cover from, so about 40% of the pending changes we have right now appear to be fairly straightforward that we'll be able to just move through.
So let me put it in plain English. Steph gets married tomorrow, her change of circumstance will happen quickly with this new technology. If you've got a complex case that Cass just pointed out, it will take you longer as we learn to use the new technology.
But I'm hearing it could be several weeks, an indeterminate number of weeks, before you can deliver the service that you're talking about in Steph's scenario.
Yeah, so, I just want to go back to.
Sorry, Steph, I'm really,
Yeah.
you know.
From an operational perspective and from a technology perspective, we need to do right by Vermonters. And that means fully validating every single business process in the live environment and making sure that our staff are fully trained to process those changes. And so we flipped the switch this weekend. That work, we need to do our due diligence, and it will take a few weeks. But I'm fully confident that over the next few weeks, we will start to be able to do those changes on the phone with customers. We just need a reasonable amount of time to get there.
And that's provided that they don't have other pending changes.
It's more difficult for us if it's sitting in the backlog. But we have business processes in place for that. We're validating. We have a team of people that are just going to be working the backlog. But because there's 10,000 cases sitting in there, they won't be worked in 24 hours.
If a customer doesn't volunteer that they have other pending changes, you guys have a way of knowing?
Yes, we can check that in the system. So we will have a dedicated team on the backlog and a dedicated team on the phones working new requests that come in. It's just going to take us a few weeks to make meaningful progress in those two buckets.
How long will it take you to get the new team up and ready to make these changes when they come in on the fly?
So we've been doing training for the past 2 weeks. The point of user validation testing, as we've talked about, is to take things that you've tested in the test environment, put them into live, and watch the transactions go the whole way. Once those are validated, we can sit down with our staff, double check that they understand all the steps in the process, that we've made any changes to those steps in the process if need be, and then get them started. So a couple weeks and we should be there.
So I just want to make this point, big picture. You know, government didn't used to be an insurance business. The Affordable Care Act has put us in the health insurance business. This deployment that's being described is exactly what I've always done in the private sector for big technology deployment. You get the tool. You want it to work. We're now at the point where we've tested it. We're excited to say we believe it works. Now you've got to put it in a live field. When you go into the live field, there are bumps in the road, there's some hiccups. It takes a few weeks to get folks trained in using it. And then if you have a backlog, this is how the private sector does it, and therefore we're doing it that way. You take the easy cases first, like Steph's, and you do them. And the more complex ones, you try to get as many done as you can quickly, so you start with the easy, you move to the tough. This is not, this is how any private sector company would deal with the same challenges that we are.
So are the automated, will you use the automated function to address the backlog?
Yes, absolutely. So understand this. In the simple cases, as well as the complex, when we got a request for change of circumstance, someone gets married, we had to go to 6 different databases that took extraordinary amounts of time and change each database to reflect that change. They didn't talk to each other. There was a lot of manual labor. There were a lot of people involved. It took a long, long time. Under this new system that Optum has so ably with our other contractors designed, these systems will talk to each other. You can change it in one database and all of the changes are implemented. That's a huge technology change for Vermont Health Connect.
What are the prospects, I think someone may have asked about this, but refresh me on the getting small businesses enrolled as entities in and of themselves. Is that in the works still, or have we given up on that?
We have not given up on that, and that's, I know this, we get into this lingo, we call it SHOP, and that's what I just spoke about. We are required, under current federal law, to be able to do SHOP, to be able to enroll businesses through the exchange. As you know, we turn to our providers, and a lot of other states did this too, Blue Cross and MVP, to do it directly. We would be thrilled if we could continue with that arrangement because it works well for us. However, federal law doesn't require us to leave it the way it is. So we and other states are working with the Secretary and others to figure out a smart solution when we have to move from the current arrangement, which we love and are happy with, to the exchange being able to deal with that particular function.
When do you have to do that?
The reason that, in my view, it doesn't make a lot of sense to move it to the exchange is that business purchases are not eligible for subsidies. So why not leave them the way they are? In other words, Don George doesn't have the ability of Blue Cross to deal with subsidies. He can't go in and check out your tax information. But that's not necessary in the case of SHOP. So we wish we could leave it the way it is. We can't, and we're working with other states, with anyone who will listen, with them, with CMS and others to come up with a smart solution to SHOP.
What's the deadline on that?
Well, we've been, take that.
Yeah, we'd be looking at the earliest for next year's open enrollment period.
But what's the deadline?
Not this coming year.
So
When is the current-
late fall of 16?
They've given us a deferral year by year.
Okay.
They're not giving us a blanket deferral, but we have a deferral.
And then
And
you
other
were,
states are getting deferrals too. It's
and
important.
then you were supposed to go from businesses up to 50 to business up to 100.
So-
Is that still on the horizon?
That's a federal change in what's defined as the risk pool, and that's happening. Businesses under 100 will be in a common risk pool with businesses under 50 and individuals, and that's a risk pool by carrier.
So they'll be handled the same way that under 50 businesses are right now?
That's correct.
Okay.
And that's January 1st, 2016?
Correct.
So what's our next deadline right now? October?
So our next big milestone is October 1st, when we need to have re-enrollment working in a functional system, and Optum has been contracted with to take on that work. The feds have just approved that contract. Optum will go to work on that with our team immediately, and that's the next big milestone.
And does this hurdle, this announcement today, is October 1 comparable? Does today inform the likelihood of success for October 1?
I should probably let Optum answer that one, but I can tell you, from my perspective, having been involved with this process, I think that the change of circumstance, getting that tool to function, is probably the biggest technology challenge that technology folks have faced. And it's not just in Vermont, in other states too. Other states, in some cases, claim that their change of circumstance works. But when you lift up the hood on the engine, I think they'll tell you that so many of them are experiencing some real challenges with it. So is it fair to say that this has been the toughest? Why don't you take that?
Yeah, sure, I'll be glad to address that. I think the change of circumstance milestone, again, was a key building block to moving towards the automated renewals capability. And so I think, though, beyond the technology, one of the key aspects of this milestone has been the collaboration between Optum, the state, and the carriers. And I think having demonstrated now the collaboration and doing what it takes to deploy changes certainly puts us well-positioned for delivering the open enrollment functionality that we're talking about here.
So when does billing become a focal point? We've heard a lot about the delays. We've heard obviously about the reconciliation process. When will it be possible to know that if you submit a check, you're not going to get that report back a couple weeks later saying you haven't paid?
So most of the billing problems we have now are in fact related to pending changes and people not having the ability to send the information relative to the correct account, updates in what people owe, updates in subsidies. So this will go a long way to resolving those issues. Even something as simple as being able to now do a change of address as a very simple 5-minute change in the change of address process over the weekend. That's huge, because if people get the right bill at the right address, we're much less likely to have billing problems. I mean, this is the fundamentals. This is blocking and tackling. And this is the single biggest improvement that we could make relative to reconciliations, relative to billing, relative to any of it. Because if you've got a billing problem, but you can't make a change to fix it, I mean, that's really the fundamental problem. There are other issues, as we've talked about, related to billing. as well in terms of custody of dunning responsibility versus custody of receivables responsibility. Those are other issues. We're not going to complicate the most important developments for those refinements. And those refinements will have those conversations later. But any major change like that also involves a whole bunch of system changes in testing and integration. So let's keep our eye on the ball. The single biggest thing we had to be able to do is to make accurate changes in the system. Once we can do that, then we continue to work on other business processes. And I compare it, I should go back too, because I think there was something that we may have missed in the question of these pending changes. Because it's not just what does that look like in the Vermont Health Connect system, and what is that change request in the Vermont Health Connect system. If the change is being requested not because the data is wrong in Vermont Health Connect, but it's wrong at Renaissance or it's wrong at one of the carriers, there's that outreach and reconciliation process that needs to go on to figure out what the correct change is. And that's why that backlog will take a while to work through. If all of this information was in one system, it'd be pretty easy. So, the governor mentioned tearing our hair out. Look, I switched to a #1 clipper cut so I wouldn't have a handle. I may go to a #2 with this change, but I'm not going to be looking like Paul Heinz anytime soon. It's way too good a handle. But, this...
We're grateful for that.
But I can't understate, this is a really big deal in terms of giving the customer service folks the tool that they need to be able to deal with the folks that they have on the phone. And I can't promise it's a light switch, but man, it is hugely better. And watching the customer service folks who were here over the weekend, who were doing the testing, and looking at the layers and layers and layers of individual fields in the database program versus the fields that they've got to work with when they're able to just make a direct change, it's truly extraordinary. I mean, we're talking about a decimal point change, and that's big. So I think there's a lot more reason to be optimistic today than we had previously.